Hey y'all, it's Nurse Sheena and I'm back with another video. So today we're going to be talking about the difference in between type 1 and type 2 diabetes. So this question kind of came up the other day when I was talking to one of my patients here at work. And she was like, what's the difference? So we're going to talk a little bit today about the difference in between type 1 and type 2. Type 1 is an autoimmune condition. It's where your immune system attacks insulin-producing cells in the pancreas. And it's usually diagnosed at a young age, like in kids, teens, or young adults. Type 2 is usually where your body is insulin resistant. The body don't use the insulin properly. So type 2 is usually due to your lifestyle. It's commonly in obese patients and is usually diagnosed as an adult. However, type 2 is more common for adults, but it is rising in younger age groups due to lifestyle factors. So type 1 is not linked to lifestyle. Type 2 is strongly linked to obesity, inactivity, poor diet, and family history. Type 1 requires insulin injections or a pump for life. Type 2 can be managed with lifestyle changes, oral meds, or insulin in the later stages. Type 1, it has a sudden onset, and type 2 is a gradual onset. In type 2, it may go unnoticed for years. Type 1 is not preventable. It's just something your body just not producing enough insulin, and so it's not preventable. But type 2 is often preventable and delayed with healthy lifestyles. So all in all, type 1 diabetes is something that your body is not producing enough insulin. That's something you can't control. It has nothing to do with your lifestyle, and it's usually diagnosed as a kid or a young adult. And then type 2 is usually diagnosed in adults, and it usually has something to do with your lifestyle. So overweight, bad eating habits, that's the major factors. And then sometimes it runs in the family. And then so of course type 1 is not preventable. You're going to be on insulin or you're going to have a pump. Type 2 is preventable or can be managed just by exercising, eating better, changing your lifestyle. So if you ever go to the doctor, they usually check your A1C. And so your A1C, you want it to be below 5.6. That means it's good. Anything 5.7 to 6.1 is pre-diabetic. And then anything over 6.1 is considered diabetes. So if you ever go and you get your blood checked and they check your A1C, that is what they're usually looking for. Your A1C is usually checked every 3 months. So it kind of tells the doctor how your body been regulating, how your blood sugar been regulating over the last 3 months. And that's how they determine whether you are diabetic or not. So that's the difference in between type 1 and type 2. If you have any questions, y'all leave it down in the comments. Don't forget to like, comment, and subscribe. And I'll catch y'all in the next video. Bye.